we were on to school shopping, and by time we had gone to drop my son off, I had more chest pain, tightness in my chest, arm pain, and I didn't want my daughter to know anything of it. So I just told her that we were going to go to the doctor's office really quick, let them check me out, and off to school shopping we go. And once I got to the emergency room, they pretty much wheeled me right back.
For someone to be so young and outwardly healthy, I thought that was very unlikely that she had a serious heart condition, but felt that the findings needed to be investigated further. So we did the ultrasound of the heart and echocardiogram, and based upon those findings, confirmed that she had indeed had quite a severe heart attack.
The next day, I had a heart catheter, so they could verify what was going on. And if there was blockages that had caused the heart attack, they could stent. If I needed bypass, they would do that.
We scheduled her for an angiogram or a cardiac catheterization to further define the nature of the abnormal blood flow. And that confirmed her diagnosis, which was very unusual, actually, a coronary artery spasm. And just like any muscle can have a spasm for various reasons, her heart artery muscle had a spasm and actually closed itself off.
As Dr. Atchley had described it, he said, they're angry. He said it's mad. And I guess they're normally nice and long and pretty, and that down my left ventricle was kinked up.
And so one of the great things that we are able to do is sit down and talk about patients who have these unusual conditions like vasospasm, and we can talk about the best way to treat her and come up with an approach from multiple different opinions to help optimize her care and improve her chances of having a good outcome.
And so it wasn't just one doctor taking care of patients, but really the whole group of doctors working together to try to provide the best care. And I think what's happened over the last over 20 years is that the Heart Institute has been able to add one by one the right doctors to fill the needs for cardiology in Chattanooga.
I was recommended to do a 36-session cardiac rehabilitation program, which I did at Chattanooga Heart.
With medical therapy and cardiac rehabilitation and ongoing lifestyle modifications such as diet and exercise that she continues to do, she has had almost near recovery of her heart pump function, and she is active and having no more chest pain, no more shortness of breath, and as long as she continues on her current track, I think that she's going to do very well.
Had we not gone there, I don't know if I would not have possibly already suffered another heart attack, and we wouldn't be here doing this right now.
Working at Memorial and the Heart Institute, I think the most inspirational thing is being able to provide the patients for whom we care the highest quality, most compassionate cardiovascular care anywhere.
Even though my heart still has some damage, and it always will, I am so thankful for Chattanooga Heart Institute, especially Dr. Atchley. He has a special place in my heart.